What is the per graft charge at your clinic? This is the most common question and inquiry we get while dealing with our patients who are coming to our clinic for hair transplant. So in this video, I will be discussing all about the intricacies of how a fee is decided and what are the methods various clinics which are mostly fake are using to confuse you and to lure you into getting your hair transplant procedures done at their clinics. Hello everyone, I am Dr. Amit Singh and I am a hair transplant surgeon based in Dehradun. REVERT Hair Clinic is the name of my clinic and I have been doing hair transplants in Dehradun since the last 12 years. Most of the people usually ask for per graft charge. To start with, there is no way you can calculate or count the number of grafts or hair transplanted on you. If you decide that I will count the number of grafts after your hair transplant, if you try to do that, you will not be able to count if you insist of getting it counted. So the clinics which are telling you per graft charge are telling you this just to confuse you. Actually, graft is not a medical term. The actual term in hair transplants, we are transplanting hair roots. Medically, that hair root is called follicular unit. In layman language, you can think of it in this way, that a follicular unit is like a trunk, and from each root, from each follicular unit, up to 4 hairs can emerge from a single follicular unit. As a follicular unit can have 1 hair, 2 hair, 3 hair or up to 4 hair. So when a doctor, suppose I am doing a hair transplant, when we start extracting the roots of the patient from your donor area, the back and the sides, we make sure to ensure that we get maximum hairs. We try to extract hair follicles, follicular units which are multiple hairs. We don't usually take single hair follicular units. We usually try to extract 2 to 4, mostly 3 to 4 follicular units. If the patient has many of these multiple hair units, we try to extract as many as multiple hair follicular units so that we can give maximum hair in a single session with a good density. So if we are transplanting 1000 follicular units and each follicular unit has 4 hair, so the actual hair that will be transplanted will be around 4000 hairs. And if every follicular unit has only single hair, then the number of hair, the final hairs that are transplanted are around 1000 only. But the catch is, the doctor, suppose I am doing a hair transplant, while I am extracting the follicular units, there is no way I myself can exactly calculate the number of follicular. I can calculate the number of follicular units more or less, but the number of hairs, no way you can calculate it. So the clinics who are charging per hair or per graft charge, they always, because to confuse you, they usually quote a per graft charge. Most clinics tell a hair as equivalent to a graft, but that is not the truth. Actually the medicals, they should, if they are trying to charge per graft charge, they should charge per follicular unit charge. But nobody tells you the number of follicular units transplanted. The commonest term used is graft, and most of the clinics tell hairs equivalent to a graft. That too, the counting is approximate. So don't go for this per graft hair charge. The thing we advise for every patient, and the protocol we follow in our clinic, is that we never charge per graft or hair. We do a thorough microscopic hair examination of every patient who turns up for hair transplant in our clinic. The hair examination is personally done by me. We calculate the density and the quality of your donor area, and we have made special stems by which we calculate the approximate number of hairs that are required to cover that area. So to cover the area, it is also a skill. The greater density is required in the frontal hairline and the mid scalp region, and the minimum density is given to the adjoining areas to cover the maximum area as far as possible. So sending your pictures to different clinics and asking for per graft or total quotation is not the right thing to do. You should visit that clinic, get your examination by the doctor who will be doing transplant at that clinic, that particular clinic. He should be a surgeon or a dermatologist. Make sure he's a qualified doctor. He will tell you the approximate number of hairs that will be required depending on your donor area. If you have a good donor area with thick hair, more hairs can be transplanted, more density can be achieved. And if the quality of donor area is average, then also you can get a good result. So we advise every patient to visit the clinic before deciding your hair transplant, and don't go fall into that trap that they are charging per graft is cheaper in that clinic, and they will be giving you 10,000 15,000 hair in a single session. These are all false claims. The truth is, you may get transplant at any clinic with any doctor. The donor area from where the roots are extracted will be the same at every clinic. And to get a good result and to make sure that every root grows, the hair transplant procedure should be completed in 6 to 8 hours. So in the traditional method, in 6 to 8 hour duration, around 3 to 4,000 hairs are approximately transplanted in that time duration. In DHI hair transplant, the technique we do in our clinic, REVERT, we can transplant up to 6 to 7,000 hairs in a single day session. Because DHI is a faster technique, it doesn't lead to damage of hair roots while implanting, and it gives natural result. We do all the hair transplants at our clinic REVERT by DHI method only, and all the hair transplants are personally done by me only. I only do one hair transplant in a single day. We don't commit to multiple patients in a single day. Then only we can ensure a good result, maximum hair, and the safety of the procedure as well. I am hopeful by this video. The biggest confusion most of the people have is what are the charges, what is the per graft charge. I am able to tell you the exact thing. You should ask the clinic to ensure that you get a good result, you get a safe hair transplant by qualified registered doctor. If you want further information regarding hair transplants, you can subscribe to our channel. You can write your specific query in the comment section or send that query through our WhatsApp to our number. This is Dr. Amit Singh signing off.